Hello and welcome to My Dietitian Journey. I'm Felicia, owner and registered dietitian at Referrals Nutrition and My Dietitian Journey. Today I want to talk about my process and some tips for obtaining patient referrals and labs. The first things that I need from a patient before calling for a referral or for labs is their insurance information, doctor's information, and also their date of birth. During the phone call when a patient is getting scheduled for an appointment, they're asked about their insurance information, and this is for two reasons. One, to make sure that I actually take that insurance plan, and two, to see whether or not that specific company is going to require referrals. All new patients are then sent access to their client portal through Simple Practice, which is the EMR that I use. There's multiple documents in their client portal. One of these is a new patient form. And on this new patient form, there's a spot for their physician's name, their contact information, the date of their last physical. I also collect their height and weight to calculate BMI. Certain BMI codes are billable for insurance. All patients also receive a demographics form, which is a section where they can enter their date of birth and then also their insurance information. All the paperwork is required to be completed 24 hours before their first appointment. And this is to make sure that we have time to verify insurance benefits and then also receive any referrals from the physician or an encounter note from their physician as well. I do want to mention that if a patient does have a deductible to be met or copay or coinsurance for their visit, I send them something called a good faith estimate through their client portal. Under the No Surprises Act, all practitioners must provide an estimated cost of treatment. So all patients who have an out-of-pocket cost are sent this good faith estimate. Once I know the patient's insurance information, I usually know right away if they're going to need a referral. Referrals are going to be required for HMO plans and also for Medicare. PPO plans generally don't need a referral. Now, in some cases, even if a referral isn't required, I either still get one or I get the latest physician encounter note to get billable diagnosis codes. And this might be the case for a patient who maybe has a BMI in the normal category, which may not be covered by the insurance company, but they have hypertension. So I can't diagnose a patient, so I would need either a referral or a physician encounter note with a hypertension ICD-10 code on it. As dietitians, we can only use certain Z codes like Z71.3, which is dietary counseling and surveillance, or BMI codes like Z6828, which is a BMI between 28 and 28.9 for an adult, without a referral or medical documentation from a physician, because BMI is just a mathematical equation. Now, let's say a patient has obesity, then you would need a referral or records with the specific ICD-10 code, since there's multiple obesity codes. So for example, E66.09 is other obesity due to excess calories. E66.0 is obesity due to excess calories. E66.9 would be obesity unspecified. In order to accept referrals, you're going to need a HIPAA compliant fax. I currently use SR Fax, which is an online fax service, and it is HIPAA compliant. I have the healthcare light option since I don't get that many faxes per month. The fax comes through as a PDF to my email, and then I can download it and attach it to the patient's profile in Simple Practice. I do want to note that I also have a HIPAA compliant email address as well. I have also had doctor's offices submit a referral electronically. However, this can be problematic since often it's not the same system that I'm using. Paraportal, for example, is for participating providers with Independence Blue Cross, Independence Administrators, AmeriHealth, or AmeriHealth Administrators. So if a doctor's office sends a referral through Pair, I can access it. There's a few things that you're going to have on a patient referral: the patient's name and their date of birth, the referring physician and their NPI, specific ICD-10 codes, and either the CPT code or something about medical nutrition therapy or nutrition counseling or even registered dietitian. I have a template that I send over to physicians if needed, but most of them do end up using their script pad. Most referrals are yearly. However, some might be shorter, like 30, 60, or 90 days. I've had HMO plans where referrals are good for 3 months. So usually I just request a new referral before their next follow-up visit. If a patient doesn't need a referral and I just need a qualifying diagnosis code, yearly I'm going to request the medical records when the patient has their annual appointment with their physician. Outside of requesting a specific referral, I usually also ask for a patient's labs to be faxed over. And this is especially helpful when I'm working with patients who have diabetes or renal disease. I did mention in an encounter note earlier. This is something that I usually request as well because it's going to have diagnosis codes, medication lists, medical history, and information about treatment for the patient. Just recently, I was looking at an encounter note for a patient with renal disease, and the nephrologist had in there that the patient needed to increase their fluid intake to 1,500 cc's, or about 50 ounces. I utilize this information to guide my session and nutrition recommendations and also set goals with the patient. This is how I might typically structure my phone calls to a doctor's office with a request for referrals or for labs. I might say something like, "Hi, my name is Felicia. I'm a registered dietitian working with a patient of Dr. X. I'm calling to obtain a referral for nutrition counseling." The front desk staff usually is then going to ask for the patient's name and their date of birth and then the fax number. In some cases, especially if the referral is going in electronically, they will ask for my NPI. I have had doctor's offices ask me to first fax them the request on a letterhead before they give me anything like labs or encounter notes. I have run into issues when requesting a referral for a patient. Many times an insurance plan might not even need a referral, like for PPO plans, but I need an encounter note or a referral for ICD-10 codes. This can sometimes be an issue depending on the person answering the phone, since they might say the patient doesn't need a referral, and then I need to explain the situation being different as a dietitian, where I cannot diagnose and assign ICD-10 codes. Other issues I've run into include delays in getting the faxed information. Usually I get something the same day or the next day. However, I've often needed to call back to the doctor's office about a referral or documentation if I don't get something in 1 to 2 business days. Another issue I've run into with doctor's offices is with the specific line for referrals. So when you call, let's say you press option 2 for referrals, I end up leaving a message and then don't get a call back or a fax. Usually I just wait 1 business day and then call and speak to someone at the front desk about what I need. If I run into any issues with getting a referral from a doctor's office, I contact the patient to let them know, and I have them reach out to the doctor's office themselves. In some cases, this speeds things along. In other instances, the appointment actually needs to be rescheduled because I don't have a referral or an ICD-10 code on file before that first session. So I hope that this was helpful to hear about how I deal with patient referrals. Thanks for listening, and be sure to leave a comment if you have questions and subscribe for more content.